introduction. I would like to extend my great honor to be here, and also I would like to thank Dr. Kat for the invitation. Um, we actually always try to gather with every single person that's working in AI in healthcare, because we believe this is one of the hot topic these days, and digital health transformation is a continuous process. And that's why when I was asked by Kathy, that's just to make a kind of presentation, I said it's excellent and it's very good topic to consider, because most of the time when I'm joining a lot of international conferences, face-to-face gathering or panel discussions, I see the fear of AI and also the promising part of the AI. So that's why I thought it's a very good topic to just to see how we can transform healthcare sector in order that we can have more of understanding how we can move from hype to strategy. So basically, um, what is AI Hive, and why strategy matter here, and what is the proof value for being considering the strategy to avoid any hype in the region, and also that to consider worldwide perspective and the roadmap to responsible AI. I will stick to the time that I'm giving, and I will try to finish within the reasonable time. So I will not give a lot of details with explicitity, but we start with even thinking what is a hype. A hype, as we always understand, it's an inflation in our thinking. It's a fear that we might think, or we might think too much about the impact and implementation of the AI tools in a way that might change the current practice or the near future practice by replacing healthcare providers. So many of the students, as I'm a professor in the university, and I'm also advisor for different startups and accelerators that will bring a lot of technologies that to the practice, to the healthcare sectors in the region of the GCC region and also in Europe. I just see that a lot of people have an understanding for the role of AI in healthcare. But the most important part is that whether they want to implement this or not. In one side, on the other side, whether that what they study can be implemented in real life and in the real practice that might help the transformational phase in a way that might consider this as a common myth or as a reality. So radiologists, for instance, there's a drop in the percentage of the radiologists who are studying radiology across the world. Why? Because they believe that the AI is going to replace their job now or later. So, and this is actually a very big myth, because what we try to understand here, and that AI is taking part as a technology. So the media is sometimes is just pushing a lot of actual fearness or hype toward the uses of AI, and whether that this is a structurized way or even like this is a random way of advertising about the different AI fragmentations and the uses of different AI technology. So we don't need to have a lot of overinflations, not in economy this time, but this time in thinking about the uses of AI in practice. So if we think about the AI in radiology, for example, thinking this as a good example, we see there's a lot of non-FDA approved, and also there's a lot of FDA approved applications or uses in clinical practice. Now, the good part that radiologists who are trained to use the AI will be in the field and in the market, then they will be more powerful in their clinical practice than those who are not used to use the AI tool. So, in a way that we can think, we don't want to avoid that overthinking of the AI and the hype about the AI, but in the meantime, we ignore the situation in a way that we just see some every day a lot of changes, and every day a lot of new technology coming to the market. So we all know that AI is very useful, but what we need to know is how we can integrate to this useful part of AI and try to avoid having any barrier in terms of piloting the work and moving from hypes to the strategy. And that's why we see most of the hospitals struggling these days in order that they can pilot the work because the manpower in the hospital either that they have a stigma toward the uses of AI because they think nowadays I'm working, I don't know what's going to happen if I'm using AI later is the management will keep me or they will reduce the number of those who are not using AI or how does it work? It's better to stay as I am and then think about AI as something that will come in the future. The issue that this is not true because AI is now taking a major role in doing a lot of ROI in the business matter for the hospitals. And successful adoptions need an integration and also evaluation. But in order to do that, we need to have a very good pilot work to look at the successful parts of AI. So what is AI successful? What is the AI, the responsible AI? We hear a lot that we have a lot of terms that called responsible AI. Responsible AI is simply that AI take into consideration ethics. I echo the voice of Dr. Kari by in having that AI is showing that we are there, but we are not very much connected. So we have a lot of demand for using AI in clinical practice. So this is aligning with the clinical goal. But what is it's helping me to have a better turnaround timing in the hospital operation. It helps me to prevent any random unmeasurable way for ROI. It is also, strategy for building AI is going to be a very good governance tool that to help me in avoiding any bias that might happen. And this is where we see the integration between the policymakers, the clinical guide, the gatekeepers in different countries, that where we can have a better guidelines and a better regulatory compliance. So thinking about the maturity of the AI strategy, we see only 1% of the organizations have reached to AI maturity despite the 95% increase in the investment. I saw that some of the sources that, looking at the AI require a ready sponsorship and ready leadership in a way that we see that the clinical KPIs for the hospitals taking part of a clinical practice, and we see people applying what they need to apply, and we see no fearness about the uses of AI. So we think now of more toward what we can, sorry, the hype of to avoid the hype of the AI. We need to define the problem that to avoid any metric success. We need always to keep in mind that we need to have a validated AI tools. It's not a very random way of selection. We need to differentiate between digital health transformation and digital health adoption. Adoption is that what we usually hear that there is a good solution that can be imported to the hospital. But is there any strategy behind this imported AI tool? We usually need to think about the validated way of um, transformational phase rather than the adoption phase. Also, we need to consider the pilot. POC is very good, but we need always to have a good, responsible POCs with a certain KPIs that might reflect to the ROI or avoiding bias or safety parts or errors. So the proof of value toward that showing more of the work, I have just looked actually regionally. I saw that King Faisal Specialty Hospital in Saudi Arabia, they have like a kind of hospital radiology AI model shows a very good return of investment over 5 years of more than 700%, and a reduction in reporting turning time up to the 30%. That means those radiologists who are using AI, they save up to 30% of their time. And this is very good for the management because this is going to be a guidance for them to help them to have more of reporting, more patients, or also to reduce the cost for different times that used in the hospital. Thinking about the strategy, the best way is the 30, 100, 50, 80, and 365 strategy, where we can usually hospital needs to differentiate again between the adoption and the transformation. After selecting different tools and thinking of different activities, we need to think of using different healthcare providers that will provide the responsible AI. So we need to identify 3 to 5 responsible AI where we can have with high value and with a good support, with a good training, and then we launched the pilot within the healthcare facility or the organization and hit a certain targets. And this KPIs, one of these KPIs, they need to be considered not only the money side, it's also the patient satisfaction and the healthcare provider satisfaction. And also thinking of the TAT, the turnaround timing, and also the accuracy of the reporting or even the integration with the electronic health records in the hospitals. So a three-stage roadmap is a very good way to have a comfortable zone where we avoid having more of the radiology side, for example, that using reporting by themselves or by dictating reports or even thinking about data labeling. With AI, we can have all of this and we can think about how this is going to be an educational tool to improve the technology uses in the clinical practice. And also we can monitor this by thinking about the pilot work that needs to be monitored with KPIs, where we can see more of the effort toward ensuring sustainability in the ROI in the long running time. So as we can understand from this short presentation that we are moving from AI hype to measurable clinical business and impact. And we need also to build trust with technology by making responsible AI rather than thinking of random AI selections. AI will not replace healthcare providers, but AI will replace those healthcare providers who are not using AI. And this is the key point message that I want to conclude with. I'm more than happy always in the future to integrate with every single person interested in the digitalizations in healthcare. And I'm always happy to communicate with business people, educational students, or even higher educational students and other people interested to think about the applications of AI in the healthcare practice and work together to create the healthy community that consider responsible AI and take part of a future digital health transformation as a continuous process in the region and worldwide. Thank you very much again, Philip and Kathy, for the invitation.